My name is Dr. Karen Luxford. I'm the Group CEO for ACHS and ACHS International, and it's my great pleasure to welcome you all here tonight to the 2024 ACHS Annual Awards Ceremony and Dinner. Tonight, we gather to celebrate excellence in healthcare and to acknowledge the dedication, innovation and hard work of the individuals and teams who have made a lasting impact on the quality and safety of care. It's a great honour to begin tonight's proceedings with the Welcome to Country. Please join me in welcoming Craig Madden as a representative of the local Land Council. Thank you, Craig.
Thank you very much, Karen. Warami, Bujirigamarua. Technology. Warami, Bujirigamarua. My name is Craig Madden, and I'd like to start by thanking the Australian Council on Healthcare Standards for inviting me here today to welcome you to country. I'm a proud Bundjalung Gadigal man from the Eora Nation, and Gadigal land is the land on which we are gathered here today. Jinyura Gadigal. This land is Gadigal. It is customary for our Aboriginal people, as we invite you, our guests or visitors onto our land or country, that we offer you safe passage as you pass through our lands. So as a proud Gadigal man and a representative of the Metropolitan Local Aboriginal Land Council, I'd like to welcome you all to Gadigal land, Aboriginal land. I'd like to pay my respects to our elders, past, present and emerging, and honour the stories and traditions of our Aboriginal people from this land. I'd also like to acknowledge our ancestors who watch over us all as we walk on these sacred lands. To our Aboriginal brothers and sisters, if we have any brothers and sisters from the Torres Strait Islands, welcome. To all our non-Aboriginal and Torres Strait Islander brothers and sisters here today, a warm and sincere welcome to Gadigal land, Aboriginal land. Our Gadigal clan is one of the 29 clans which make up the Eora Nation. That's a nation that's bound by 3 distinct landmarks. So we've got the Hawkes River to the north, the Nepean River out to the west, and the Georges River down to the south, and within the boundaries of those mighty rivers lay our Eora Nation. The land that we gather on here of our Gadigal people, as mentioned, is one of the many clans of that nation. To our guests from across the seas, anyone from across our great country, great states, this beautiful city of ours, which is going to storm and hail in a minute, but that's okay. Welcome to Gadigal land. And look, it'd be remiss of me not to say congratulations on 50 years to ACHS, is it? Yes? ACHS? Congratulations on 50 years, what a wonderful achievement. And on behalf of the Metropolitan Local Aboriginal Land Council and its members and our Gadigal mob, for those of you who are travelling far this afternoon, please travel safely. And once again, welcome, welcome, welcome. Thank you.
Thank you very much, Craig, for that wonderful welcome to country. I would also like to acknowledge the traditional custodians of the land on which we gather today, the Gadigal people of the Eora Nation, and pay my respects to elders past and present. And I extend that respect to any Aboriginal and Torres Strait Islanders who are here in this room with us today. The awards ceremony this year holds special significance, as Craig mentioned, as we celebrate the 50th anniversary of ACHS. We had a great day today in our council meeting, and we were privileged to have Dr. Zoran Bolovic, who has joined us here tonight as the new CEO of AIHW, who was reflecting on the history of AIHW and also mentioned the age of Medicare, which is only 40 years, so ACHS preceding Medicare, so that's a great milestone. We're especially honoured to mark this occasion with all of you. Our ACHS award winners, our council members, our board directors, assessors, staff and esteemed colleagues from across the healthcare sector. This anniversary honours our rich history and ongoing commitment to healthcare quality and safety. For over the past 5 decades, we have evolved, we have adapted and we've grown, always with the goal of supporting our members to deliver the highest standards of care. We are proud of what we've achieved together and we look forward to the next decades ahead. I'd like now to share a video to celebrate our 50th anniversary and take you on that journey through time. We proudly celebrate the 50th anniversary of ACHS, Australia's leading healthcare accreditation provider. In honouring how far we have come, let us journey back to where it all began. It started with a vision. In 1974, our pioneers set out on a mission to transform healthcare in Australia. With a lack of industry standards, our founders' foresight led to the establishment of the nation's first healthcare accreditation system. The first hospitals accredited by ACHS were milestones that set the scene for transformation. Our unwavering commitment to our mission is what drives our growth and longevity. As ACHS became well known and interest arose, more hospitals were surveyed, extending to the ACT and Northern Territory. After the Commission was established, the NSQHS standards were created to further help protect the public from harm and improve the quality of healthcare. ACHS has continued to build a relationship with our members to support safe, quality care, and that is what sets us apart. We share our journey with a remarkable community of ACHS members, assessors, and colleagues. Every year, we recognise and celebrate innovation, resilience, and excellence. As we grew, so did our aspirations. With the establishment of ACHS International, we strive to help build world-class healthcare systems around the globe. To our members, we are trusted partners for quality improvement. From our Improvement Academy short courses, lead training program, to our exclusive masterclasses with global healthcare experts, we empower our members with the skills to deliver the best care possible. For over 33 years, ACHS has been at the forefront of healthcare performance data, supporting our members with a consistent and valuable way to track, measure and benchmark their data to drive quality improvements. Healthcare continues to evolve, and so do we. We are driven by a commitment to pioneer and lead. Our future is marked by embracing new technology and supporting members to provide the highest quality of care. As we celebrate our rich history and legacy, we would like to thank our members, staff, assessors, board and council for your unwavering commitment. Together, we remain committed to build a better future for our communities and patients. So thank you very much for being a part of that journey of the 50 years. And we've got little small gifts on the table for each of you. And under our sustainability approach, they're recycled materials. So we hope that you will take those with you and enjoy those. So tonight we will be announcing the winners of the 2024 QI Awards and the ACHS Medal. This is a moment to recognise the passion and the hard work that truly defines our sector. This year we've seen some remarkable achievements across our own organisation. I'd like to just take a moment to highlight a few of those. This year we've taken the important stride towards sustainability with our own sustainability strategy. Our passionate Sustainability Committee has been making important changes to reduce consumables, cut energy use, introduce carbon offsets and minimise our environmental footprint as an organisation. Equally, we are supporting our member organisations as health services around the country with expertise on sustainability from global experts. We're also proud of beginning our next chapter of our Reconciliation Action Plan as we move into the Innovate stage. We're dedicated to shaping a vision for reconciliation and looking at how we can make a difference in our communities. I'd like to take a moment to express my appreciation for our amazing staff, our assessors, our president, our board of directors and council members. I'm genuinely proud of all of the work that you do and to work alongside you as a talented and dedicated team. Thank you for your tireless efforts and for being a part of this integral ACHS journey. So now, without much further ado, I'd like to invite Professor Len Nataris, AO, the President and Chair of the ACHS Board, to deliver his welcome message. Thank you, and I trust you have a wonderful evening.
Thank you so much, Karen, and thank you also for Craig Madden for the welcome to country. As President of ACHS and Chair of the ACHS Board of Directors, it gives me an enormous pleasure to extend my welcome to each and every one of you today, all distinguished guests, every single person here. It's wonderful to be celebrating 50 years, our 50-year anniversary, and amazing to see how far we've come since those early days. Over the decades, the progress that's been made, the impact that ACHS has had, and the improvements that ACHS has driven in healthcare are truly something to be proud of. Most of you weren't born 50 years ago. Well, I can say that. Maybe some of you were born. I certainly sort of just was born. But 50 years, 5 decades, a phenomenal legacy. Today, as many of you know, ACHS stands proudly as Australia's leading healthcare accreditation provider. We're doing important work in safety and quality, and I recall the Safety and Quality Commission when we were throwing around whether it be quality and safety or safety and quality, and it was always safety first, safety first. Do no harm, safety first. So we're doing important work in the safety and quality arena, empowering healthcare organisations to continually raise the bar and deliver the highest standards of healthcare. Our reach, of course, goes far beyond the domestic market, far beyond Australia. I can remember the early days, and I saw a picture of Desmond up there when we established ACHSI. And ACHSI, as the for-profit wing of ACHS, the not-for-profit organisation, has established a tremendous inroads internationally, whether that be in Saudi or in the UAE, Abu Dhabi, and all of those places, or whether it be in Taiwan and other places across the world. It is a brand name that is to be revered and definitely is being emulated. Tonight, we're gathered to celebrate the fantastic achievements of our community. I'm excited to announce that we have a very special guest speaker in Professor Janine Mohamed, a proud Ngurugu Kurung woman who has dedicated her career to First Nation health. Janine will be joining us a little later. Her flight has just set down, or is about to just set down at the airport. And if she doesn't make it, I've already told Paul and Neil that they'll be the guest speakers for the evening. So you better prepare just in case. Shortly, we'll be commencing our presentations, which are the ACHS Medal and the Quality Improvement Awards for 2024. Our incredible award winners this year have demonstrated the power of collaboration, innovation, and indeed shared commitment to healthcare excellence. It's a privilege, a true privilege, and I mean that sincerely, to acknowledge their outstanding efforts tonight. Today marks exactly 1 year since we stood here and launched the new performance data mechanism, which is metric, and its impact has been significant already. That is the impact of metric, and some of those intimately involved in that launch are here tonight, and I thank them for that. Metric has empowered healthcare organisations to make informed strategic decisions, driving continuous improvement and delivering measurable results. This is, in turn, a facility that has fostered a stronger culture of safety and quality across the networks, And I'd like to take the opportunity to acknowledge again, the tremendous team that have made this possible. So thank you, each and every one of you. This year, in support of our members, ACHS has made significant progress in strengthening our digital infrastructure, ensuring that we continue to provide exceptional service to our growing membership base. And we learned today during our council meeting that base is rapidly growing even further. I'm now delighted to formally launch the ACHS Clinical Indicators Report 2016-2023, otherwise known as ACER. The new report, which is right here, summarises the data submitted to our clinical indicator program, highlighting significant trends in healthcare data over time. This year, we're pleased to announce the introduction of new indicators for ambulance service as well, ambulance health services. And I acknowledge the work of David Waters, Chair of the Working Party, and indeed the work of Stephen Tobin as well. With that, you're off the hook now, Paul, and we have our guest speaker, so sincere welcome as well. Having said that, I'm delighted that we're launching that tonight. I'd also like to take a moment to acknowledge our Board of Directors, tremendous, collegial, communicative, loyal and supportive. The council members who showed today just how innovative and how good they are at contributing to our vision. I'd like to also thank Karen and her executive, the executive directors, the managers, and all throughout the organisation who well and truly punch above their weight. 62, 63 individuals who actually make a phenomenal contribution. Your support, strategic vision and dedication have been instrumental in guiding us through this significant year and beyond. And I mentioned a little earlier today at our council meeting how that group guided us through the incredibly unsure times that we call COVID and look back at now. I'd like to make an honourable mention to two retiring ACHS council members, one being Russell McGowan. And I mentioned a little earlier the Safety and Quality Council, which goes back to the mid to late 90s, and Russell sat on that with me and a group of other people, and they were incredible days, and the product of that, the commission, is outstanding and an icon for the world. Russell can't be with us tonight due to ill health, but Russell is retiring from our fold, but he has been with us a considerable amount of time and has made a significant contribution. I'd further like to acknowledge him for his overall commitment to safety and quality in healthcare and consumer voices since the early 90s. Thanks very much to Russell in his absence. And the other person in his absence I'd like to acknowledge is Phil Truscott, who represented the College of Surgeons. Phil has retired from surgery and is retiring from our ranks as well. He's been a counsellor for several years and has made a significant contribution. Now, it gives me enormous pleasure to announce the recipient of the ACHS President's Award for 2024, an award that recognises an individual for contribution to ACHS. This year, I'd like to congratulate an individual. Some of you may know, some of you may not know. He may not know that he's going to be congratulated. Oops, I've given half the story away. It's a he. Tony, congratulations. You've been awarded the ACHS Presidential Medal. Tony's a former member of the ACHS board. He's chair and director of the Consumers Health Forum of Australia and has been on the board and the council for more than 11 years, serving as a valuable contributor. Tony's involvement spans across numerous committees, the Board Finance, Audit and Risk Committee and the ACHS Governance Committee. Please, Tony, come join me as well.
It's so unlike me to want to hog the microphone. This is just blowing me away. I can't believe this. feel a bit emotional about actually. But as Len said, I have been involved with ACHS for over 11 years in a number of capacities. Absolutely love this organisation, and I suppose you just need to know when's the right time, and that at the end of last year was the right time. But I miss this organisation so much. It's so lovely to see so many friends that I've made during that period here tonight. And I have to say, as to endorse Len's words about the quality of the board, I have to say, having been involved in a number of boards over years, it's the most collegiate, professional, communicative, and just a bunch of wonderful people who do a great job in safety and quality. And also add that the leadership under Karen, since her appointment, and the fantastic executive team and staff, ACHS is a marvellous organisation, and really does a fantastic job in safety and quality, improving health outcomes for the users of our wonderful health system. Thank you so much. I'm very humbled, and particularly in the 50 years of ACHS. And I served on the board for a decade of those 50 years.
Finally, and thank you, Tony, well deserved. Tony has been a true stalwart of our organisation, as to our other directors, but Tony has done so much, and he has been the true champion of consumer health as well. Finally, I'd like to express my gratitude again to the ACHS staff, the terrific work. You're the very backbone of this particular organisation. You actually make things happen, and in making them happen, you make them happen successfully. Your terrific work is well recognised. I hope you have a fantastic evening, each of you distinguished guests here tonight. And it says here, let the celebrations begin. So I'm not too sure what that means, but please enjoy the evening. Thank you.
Thank you, Len. And Neil Fong was suggesting we should be having fireworks. I'm not sure that they would allow us that inside the building codes, but we could give it a go. Thank you, Len. I'm delighted now to announce the eagerly awaited winners of the 2024 Quality Improvement Awards. This year saw an impressive number of entries, and I want to take a moment to thank the judges who were involved in the judging for the awards, and to commend all the participants for their outstanding submissions. The Quality Improvement Awards are now in their 27th year, and they recognise healthcare organisations for their exceptional efforts in quality improvement activities, initiatives and strategies. I'll begin by announcing the recipients of each category, starting with the highly commendeds before announcing the winners, and then we're going to share a short video of each of the category winners. And the winners will come up to the stage to receive their awards. They're going to elaborate with a few minutes on their quality improvement projects. We would like to start with the first category, clinical excellence and patient safety. The highly commended certificate was awarded in this category of clinical excellence and patient safety to the following healthcare organisations, and we have 3 highly commendeds. Fiona Stanley Fremantle Hospital Group for their submission, Virtual Immunology Clinic for General Practice. Hunter New England Local Health District for their submission, All Together Now, coordinating care for kids with medical complexity in the Hunter New England Kids Compass project. And the 3rd highly commended, Western Sydney LHD, Blacktown and Mount Druitt Hospitals for their submission, the Young, Strong and Deadly, a 14-week Aboriginal-led health education and physical exercise program. And the winner of the ACHS Clinical Excellence and Patient Safety category is, drumroll, SA Medical Imaging, CALHN and Women's and Children's Health Network South Australia for their submission, Fast Advice and Access for Intravenous Routes with Imaging Service. Congratulations. Please come and join us on the stage.
SA Medical Imaging is South Australia's public imaging service provider, bringing together medical imaging services from across 6 metropolitan hospital sites and 4 country sites. The FAAIRI service is an excellent example of when clinicians work together, we can provide the best possible care, but also an example of how when networks work together, we can aim to provide the best outcomes for our patient cohorts.
The FAAIRI service is the first comprehensive nurse-led service for vascular access for children in Australia, and we provide access to children who have difficult IV access or who have longer-term IV access needs. We are able to place lines on the first attempt for children using ultrasound guidance, and that leads to less attempts for children. Previously, some children were having up to 15 attempts to have lines put in and were sometimes waiting 36 hours to have a drip put in. And that has led to better vessel preservation for children and less trauma for them and their families.
My other role is the clinical lead for Standard 3, and part of Standard 3 is looking at vascular access devices. And with the help and the support of the Infection Prevention Control Committee and the Vascular Access Service Governance Group, we look at and make sure we have the right procedures within our hospital, the right education that is done with our staff that are looking after the lines and also putting in lines.
We now see more than 1,000 children a year to have drips put in who've got difficult IV access, and because of conversations with clinicians who refer to our service, we have doubled the amount of PICC insertions our service provides, and this means for those children that they will get less vascular access devices during their treatment. I would like to firstly thank ACHS for this award on behalf of our team, some of them are here. The establishment of the FAAIRI service would not have been so successful without the fantastic support and collaboration we've received across many departments within our 2 health networks, South Australian Medical Imaging and Women's and Children's Health Network. I would particularly like to thank our executives and clinicians in medical imaging, infection control, anaesthetics, our vascular access governing group, and safety and quality departments, some of whom are with me here tonight. Having an IV inserted is the most common invasive procedure which happens for hospitalised children, but several international studies have shown that half of them need more than 1 attempt using traditional insertion techniques. By using ultrasound guidance for children with known or predicted difficult IV access, our specialist nurses can insert an IV on the first attempt 98% of the time. Through assessment of every referral to ensure the right line is placed the first time every time, we've also doubled our PICC insertion rate. This means less needles overall for children who need longer-term IV access. By utilising these 2 aforementioned strategies, we're aligning with the Australian Commission on Safety and Quality in Health Care Management of Peripheral Intravenous Catheter Standards. I believe we've rapidly changed the landscape for children with difficult IV access, and I think the most powerful way of demonstrating this is through the voices of caregivers. From the mother of a 12-year-old child with difficult IV access prior to the implementation of the FAAIRI service, whenever he had to get a drip or blood test, he would talk about it for days in advance, about how stressed he was, how he was going to have a terrible day. And then from a mother of an 8-year-old child who frequently uses the FAAIRI service. It's been amazing. His attitude towards his treatment has totally changed. He's happy to go along. It changed his whole mindset regarding having his treatment and dealing with the condition he's got. Whilst our comprehensive nurse-led paediatric vascular access service is the first in Australia, it would be easy to replicate this service model elsewhere, and it's currently envied around the country. I hope that our example inspires other clinicians who are thinking about future projects to reach across disciplines, departments and organisations as we have, with rapid and widespread improvements to patient safety and quality. Thank you.
Congratulations again to the South Australian Imaging team. I love that you managed to get your project name into an acronym that said FAAIRI. That was very well done for children's service. Our second category tonight is the non-clinical service category. we have a highly commended certificate awarded in this category of non-clinical service delivery to the following organisation: Children and Adolescent Health Service WA for their submission improving children's access to novel and emerging treatments, ensuring equity of access to our patients. And the winner in this category for non-clinical service delivery is Sydney Local Health District for their submission harnessing byproduct water, advancing sustainable water management in the local community. Congratulations, come and join us.
At the Kidney Center of RPA Hospital, a water purification system using membrane filters produces ultra-pure water for dialysis. Potable water does not meet the stringent standards which are required for renal dialysis, and thus it requires extensive treatment. The water treatment process includes pre-filtration, softening, filtration through active carbon, and RO unit. RO treatment, which is the critical step in this process, uses a semi-permeable membrane to remove ions and contaminants from potable water. The product water for RO treatment is clean and safe for drinking. This process generates approximately 1.5 million liters RO reject water annually, which is typically discharged into the sewer system.
So far, we have used almost 215,000 liters of water to clean our street.
What makes this model particularly valuable is its adaptability. It can be applied in various settings. Ultimately, the project's success emphasizes the importance of creative solutions in addressing environmental challenges while delivering both economic and operational benefits.
Initial analysis showed us that water carting is the most expensive water supply option. But a second thought, we realized that we already have about 30 street sweepers and street scrubbers that needs to fill water almost every day to clean our streets in the LGA. And from there, we realized that this is a sustainable option that's going to provide the city with a cost-effective water and also increase resilience because this water doesn't rely on rainfall.
Good evening, ladies and gentlemen. My name is Chin Foon. I'm the Director of Biomedical Engineering in Sydney Local District. I would like to thank Sydney Local District Executive, our Executive Director of CIE, Capital Infrastructure and Engineering, Mr. John Gowdy, for his support that enabled the success of this project. Thank you, Cash, our renal team lead, and also this project lead. Thank you, Ryan, our biomedical engineer from renal team. He is also the primary author of this QI submission. Cash came to me or presented to me with this concept design to harvest renal reject water, and I would like to thank you, Shane, the team lead of Capital Works in CIE, together with Rodney. They transformed this concept design to become the reality. I would like to thank Mufik and Nico and the rest of your elite team from the Council of the City of Sydney. You are the important piece that complete the full circle of this solution, utilizing the harvest water to keep our City of Sydney clean on regular basis. Thank you. Last but not least, 2019, 5 years ago, Sydney Local District Biomedical Engineering, we received our very first ACHS QI award. And yes, tonight is our second win. Good work, team. I would like to thank ACHS for such an honorable national recognition. Folks, ladies and gentlemen, we, Sydney Local District Biomedical Engineer, We'll be back with more QI to share with all. Thank you.
Thank you. What an amazing project. Always great to see that innovative thinking. So our final category for the QI Awards, and you know the drill now, you get the highly commended first. Highly commended in the category of healthcare measurement. Firstly, Royal North Shore Hospital for their submission Excellence in Hip Fracture Care. And the second highly commended is Townsville Hospital and Health Service for their submission Improving Rates of VTE Prophylaxis Prescribing at Townsville University Hospital. And the winner of our final category of ACHS Healthcare Measurement goes to Western Health Victoria for their submission Piloting a Power Shift Through Food. Please come and join us, Western Health.
Grant Lodge is a 30-bed aged care facility 50 kilometres west of Melbourne. In November 2022, Western Health initiated a dietitian-led project to develop and implement a person-centred framework for food, nutrition and dining outcomes for residents at Grant Lodge. This also looked at engaging residents and empowering them in their participation in the meal and dining experience for residents. There was limited mealtime assistance to residents, except for those residents requiring full feeding, and staff often rushed to clear the tables and meals so that the dishes could be returned to the kitchen. The dining room lacked that place of coming together for meals for residents to allow for social interaction and enjoyment. This project aimed to enhance the residents' wellbeing and dining experience in accordance with the best practice standards. It also aims to empower and engage residents in the decision-making for the dining experience and to engage and collaborate with key stakeholders at Grant Lodge to ensure that all groups are involved with the focus of food, nutrition and dining experience for our residents.
Thank you. A little over 2 years ago, Western Health began a journey to improve food and the dining experience for the residents of Grant Lodge in Bacchus Marsh in Victoria. One of those residents we met was Pearl, who was 102 years young and had lived at Grant Lodge for 6 years. Pearl was at times slightly agitated, could not be engaged and typically wasted 60% of her meals. She was at high risk of malnutrition. Through our food-first approach, we have seen a revolution in the dining experience from involving residents like Pearl in decision-making, creating individualised meal plans, to the creation of a warm and inviting dining area. Pearl was given the space and time she needed to eat at her own pace. Special cutlery and crockery gave Pearl independence. And we saw Pearl smile and laugh at mealtimes. Her food intake doubled within a year. She no longer needs nutritional supplements and her weight has gradually increased. Overall, resident food satisfaction increased to 85%. Residents now consume 70% of their meals and 81% of residents have maintained or increased their body weight. Losing weight or becoming malnourished is not inevitable as you age. This is a dietitian-led program, but would not have been possible without my colleagues Vicky Barrington and Catherine Marshall, without the dedication of Grant Lodge nursing staff, educators and management, the Bacchus Marsh Food Services team and Western Health executives. And of course, this program would not have had such success without the active participation of residents, relatives and advocates. One such advocate said, "You're piloting a power shift through food. It moves us all to a perception of shared values and common goals. It's wonderful for residents to be respected, to have their opinions sought and to be treated as equals. It is a great honour to win this award, and I thank ACHS for this acknowledgement. And I would like to dedicate the award to past residents Sadie and George. Thank you very much.
Congratulations again to all our QI Award winners. You should be very proud. Let's give them another round of applause. Over the past 50 years, ACHS assessors have been foundational to our service and integral to the assessment of the quality of care across Australia. We recognise that our assessors are at the forefront of conducting assessments with our members, and you play a pivotal role in fostering safe, high-quality care for our community. We couldn't do this without you. I often hear firsthand from our members about the valuable insights that they gain from you, our assessors, and it's clear the positive impact that you make. Thank you to all our assessors for your dedication, commitment and support to ACHS and helping our members to deliver safe, quality care in the community. Please give them a round of applause. I'm also delighted to extend a warm welcome to our new group of assessors who have joined ACHS this year. Congratulations and welcome. You're a vital part of the ACHS assessor cohort, and we look forward to the knowledge and expertise that you will bring. Lastly, as CEO, I'd like to recognise our exceptional ACHS team who have been instrumental in ACHS's journey over the past 50 years. As ACHS has evolved and grown, so too has our team, continually adapting and rising to the new challenges that we see in healthcare. I'm extremely proud to see their hard work reflected in the positive feedback that I receive on a regular basis from our members, as well as through our member survey results. Whether working behind the scenes or directly with our members, each and every one of you play a vital role in our success. Thank you and well done. Please join me in thanking you. And now I'd like to hand back to Len to announce the ACHS medal winner for 2024.
Thank you so much, Karen, and well done to all the QI award winners, assessors and staff. Well done. That's a fabulous achievement, so congratulations. It now gives me great pleasure to announce the winner of the much anticipated 2024 medal, and now into its 40th year, 40 years. The prestigious ACHS Gold Medal celebrates the achievement of an individual who's made an exceptional contribution to the safety and quality agenda in healthcare. Tonight, we have that person with us. He will be signing autographs later, but we have that, I've given it away again, that's a he. He'll be signing autographs a little later. Please join with me in congratulating this year's ACHS winner, Professor Paul Kelly. Paul Kelly is a public health physician and epidemiologist with more than 30 years of research experience. He's worked around the world in health systems, developing and infectious disease epidemiology as well. He's a former Chief Health Officer of the Australian Government Department of Health, and he spent a distinguished career dedicated to the investigation and delivery of best clinical care, not only domestically but also internationally in third world and under-resourced nations. Paul was one of the leaders in developing the FluCAN project, a national influenza surveillance system used by hospitals to track patients who are hospitalised with influenza. This work helps determine the effectiveness of the yearly influenza vaccine. Paul was Chief Health Officer for the ACT, the Australian Capital Territory, and Deputy Director General of Population Health ACT Health Directorate. He's also a member of the National Health and Medical Research Council and a founding partner of the Australian Prevention Partnership Centre. He's also a member of the expert advisory groups for the Australian Burden of Disease Study of two World Health Organization groups, advisory groups, the International Health Regulation Roster of Experts and the Nutritional Guidelines Advisory Group. Paul's work has taken him to 5 countries on 4 continents: Malawi, Indonesia, East Timor and the UK. Paul has demonstrated himself as a passionate advocate for safety and quality agenda, as well as being responsible for significant improvements in healthcare. As I congratulate Paul on winning this particular award, I have to say Paul became iconic throughout the COVID period. And if you remember correctly, Paul the resounding cry was Kelly in the telly or on the telly. And I think children would go up to the telly and look to see if Paul was still in there. But Paul did a fabulous job through that particular period, and I'm greatly honoured that he and I worked very closely. I got calls in the middle of the night or in the late afternoon telling me about the ghost ship off the West Australia coast, other calls that told me about other things that were happening in other places. And it was a time that Paul exhibited courage, real courage. There were decisions that had to be made that other individuals probably would have quavered, would have balked at doing, but Paul didn't. He gave informed decisions, very informed decision, and history has shown that they were the right decisions at that time. Paul and my history goes back long before that, and I remember when we were evacuating East Timor at the time with the troubles that were occurring up there. And I went to Paul, who was then in another in the Northern Territory, with me, and I went over to what was Black Bloc 4 at that particular time, and Paul at 3 a.m. in the morning, as the refugees were about to arrive, was working with his team. And I said to Paul, everything under control? And Paul said, well, yeah, we're working hard, but we're all starving. We're all going to collapse any moment now. And I must confess, to his absolute credit, I was able to go to the executive chef of the hospital and ask him could he make some sandwiches at 3 and 4 o'clock in the morning, which he did, and the team continued working. During that period, late 90s, that team worked day in, day out, for something like 3 to 4 days around the clock. And I mean, we talk about COVID and we talk about what happened then, but that was a tremendous achievement. And Paul's leadership and Paul's significant contribution then, as now in the things we've talked about, as during COVID. One final comment, as somebody said to Paul once, how do you actually, and I was there when they asked the question, how do you actually unwind with all these things during COVID? And he said, well, I'm into Scottish dancing. So have a look at his ankles and you'll see the scars. But Paul, if I might, please join me and thank you so much.
Thanks, Len. Wow. To win a gold medal on the golden anniversary, it's got to be something special, right? I did think of wearing a tracksuit. I thought that'd be appropriate, but I did actually put trousers on for the first time. 3 weeks ago I retired, so I actually got dressed up with a tie for the occasion. So thank you. It's a great honour to be standing in front of you, and I just want to acknowledge and thank both Karen and Len for organising today. Also acknowledge the Gadigal people of the Eora Nation and Uncle Craig for his great welcome this afternoon. I did, as preparation of, Karen sent me some copies of the last 2 years of these speeches. She also said, don't go over 6 minutes. I did count that Neil had 12 minutes last year there, and so did David the year before, so I will indulge a little bit longer. Just in a note to Neil, if those of you that were here last year or might have seen his talk. So we're both West Australians, both UWA graduates, both did our internships at Royal Perth Hospital. So I was an intern 40 years ago. That was when the first of these awards were awarded. It also happened to be this month was when I met my wife, Jennifer, who's been an extraordinary support to me all through that period, particularly during the COVID period. Over a patient at which I almost killed, but luckily she's a very skilled nurse and she didn't hold that against me. But I was just an intern. The other note that Neil mentioned was I think being thrown at you by your Year 11 maths teacher who said you won't account to anything. And it was my Year 12 maths teacher who laughed when I said I was going to go and do medicine about 6 weeks out from the Year 12. So we've got those things in common. David Pilcher 2 years ago talked about his work with ICU and the CRIS system, if you remember, and that was absolutely integral to how we worked through early days of COVID about what was happening in ICU. And he mentioned the extraordinary achievement in Australia where we had less than 50% of the average global mortality in ICU from COVID. Extraordinary work, and really demonstrated safety and quality in healthcare at that really pointy end of healthcare in ICU. But I would put that a lot of that was due to the work done in public health and outside of hospitals in terms of decreasing that burden of disease during those crucial times pre-vaccine in particular. So it's 40 years since the first of these awards was given to Lionel Wilson, an absolute giant of the profession and a foundation of so much that has been achieved since that time, in the 50 years of ACHS. And so, we really do stand, all of us here, on the shoulders of giants. And I'm, as I said, feel very privileged to be given this award tonight. This morning I was at the annual World AIDS Day breakfast in Parliament House, in the Great Hall of Parliament House. Extraordinary time to see people there, and it's something I've been involved with since my PhD time, is HIV and tuberculosis. There was a panel session this morning, and it talked about, and I think this is really key to the work that is done here and everyone in this room and everyone that you represent. How do we succeed? And when you think about back on the HIV/AIDS epidemic since 1984, actually, or around that time in Australia, it's multi-partisan political commitment, and there were people from all sides of politics there today giving very strong support to continue. The community at the centre and leading what needs to be done, and science being listened to. And I think if I was to sum up the award winners of today, all of those elements, the award winners here tonight, talked about that. Recognising community need, having curiosity, being innovative, being supported to do that by hospital executives and health executives, and having science and wellbeing at the centre of what you do. Because health is a human right. And healthcare is also a human right, and safe and high quality and equitable healthcare, which takes into account cultural safety and cultural perspectives, which I'm sure Janine will talk about shortly, is a human right. And to be able to achieve that, you need organisations like ACHS to work through that. And that's been demonstrated tonight. So 3 quick anecdotes. One of them has already been stolen by my colleague here on my left, about my past and my recent present, because I can't not talk about COVID, and the future as I see it in terms of healthcare and health quality and safety. The first I'll talk about is actually some time, and Len mentioned my work in Malawi. So when our son, now 33, was a baby, and Jenny and I went to work in Malawi, I was involved with direct healthcare at that time, running a 200-bed hospital, and really seeing how models of care can be used in that way, where there were 2 doctors in a 200-bed hospital. There was no way we could do everything, and we relied very heavily and strongly on others, particularly nurses and midwives and medical assistants, to do most of the work. The first thing I did when I arrived at that hospital was to check the boils machine in the operating centre, which had been there for probably about 30 years. Every single one of the tubes in the boil machine were broken, and all of the dials didn't work. So I immediately removed all of those tubes and removed all the spare tubes that I found that were also no longer able to be used, and banned the use of the boils machine from then on. We did epidurals and other forms. It wasn't popular, but it was a life-saving procedure. The other thing, we had post-operative, an unacceptable post-operative mortality rate, and so I set up the first ever high dependency unit in the northern part of this country, Malawi and Central Africa. And that became really important when we had a gynaecologist came and joined us who'd worked with Catherine Hamlin in Ethiopia, and she knew all about vesica vaginal fistula, something that I'd never seen at the hospital in the 2.5 years before that time. She arrived, found one patient, and within a month she was doing 3 sessions a week, and all of her patients were going to this high dependency unit, and that was really changed the lives of these so terribly unfortunate women who'd been ostracised by their communities. The TB in Timor-Leste was mentioned by Len. What he didn't mention was he actually delivered the sandwiches, which was extraordinary. He was the boss of the hospital. You know, he was too scary to talk to most of the time. But he at 3 o'clock in the morning he recognised a need, and he sustained us. Not only us, but also the people we were screening that had come, and we'd done all sorts of things to them, but they hadn't been fed and they hadn't had anything to drink for up to 24 hours, so that was very gracious. But during that 3-day period that Len mentioned, we actually screened 1,800 people for tuberculosis and other illnesses. We found 3 years' worth of tuberculosis patients during those 3 days, and assisted them and worked through them and protected the community from further infection. But most importantly, we used that data then to take to Timor-Leste, and I was very privileged to work with Timorese colleagues to set up a national TB program for independent East Timor, and using that data to guide what we needed to set that program up in a safe and high-quality way. The final of my past is COVID, incredible journey. And I think, you know, many of the things I already mentioned to do with ICU and so forth, but also quality and safety in treatments and vaccines, public health action, public health science leading political action. It was quite an extraordinary time, and that flowed through to the safety and quality in healthcare as well, and I'm very proud of working with the team that achieved that. So what are the lessons I take from my career? It takes a village to do this. You can't do it as an individual, and it's all about teams. It's all about collaboration. It's all about talking to each other, knowing who to call, having great mentors and networks, being curious and persistent, striving for quality and safety, and measure what needs to be measured. Data is key, and Zoran's here tonight. He knows that, you know, in God we trust, but, you know, all else bring data, correct? But data is not sufficient. We have to listen to patients. We have to listen to their families. We have to listen to the community. We have to take in cultural perspectives. And care is at the centre of all of this. It's actually, healthcare starts with caring. Future challenges, and some of them have been mentioned by Karen earlier in her opening speech. Obviously data, absolutely key. We've seen from the COVID report, trust is absolutely key as well, and it's hard won and easily lost, and we need to think about that, how we regain and foster the trust of our communities in the work that we do. I'm very proud of and been privileged to work on a climate and health strategy, which was launched last year at COP28, and is now being definitely moving ahead with an extraordinary team in the Department of Health and many partners, including the Commission. So the Commission's been terrific, and I know there's a representative here tonight from the Commission, as well as clinical colleges. But really, as a challenge to you, Karen, and to the organisation and assessors, think about how the work of the ACHS can actually assist with that sustainability challenge that we have, is an important one. So finally, I just want to acknowledge my mentors, my colleagues, my family, and especially my darling Jenny, for all the great support. I couldn't have done it without you, and thank you, Len, so much for this great honour.
A big congratulations once again to Paul, and it is, as you say, Paul, very exciting to win this in our 50th year, so congratulations to you again.
It's my absolute pleasure now to introduce our distinguished guest speaker, Professor Janine Mohamed, an Arunga Kuruna woman who over the last 2 decades has made substantial contributions to nursing, management, research and health policy within the Aboriginal Torres Strait Islander health sector, including her leadership as CEO of the Congress of Aboriginal and Torres Strait Islanders. Having said that, Janine comes to us from the Luigi Institute and Australian National Institute of Aboriginal and Torres Strait Islander Health Research, and was recently honoured with the 2024 Victorian Australian of the Year. Congratulations on that. Professor Mohamed is dedicated to dismantling racism, advancing opportunities for Indigenous health workforce and closing the gap in Indigenous health outcomes through systemic integration of cultural safety. Without further ado, I'd like to welcome Professor Mohamed to the stage and thank her for being here tonight.
Okay, good evening everyone. I'm the person that gets to talk after dinner and I will try to be quick. But before I begin, of course, I want to acknowledge the traditional custodians of land in which we meet tonight, the Gadigal people, and I pay my respects to their elders, past, present, and of course, most importantly, our future emerging generations. Thank you to the ACHS, Len and Karen, for inviting me to speak here tonight. And of course, congratulations to the award winners. There's a couple of comments I'd like to make on that, but I especially extend my congratulations to Professor Kelly. And thank you, Jennifer and family, for lending him to us, the Australian public. Behind every good man. And I also want to say, and it's possibly a little bit controversial being the Victorian Australian of the Year, that I am actually South Australian. And further to that, I'm a former CALHN board member, and I'm the mother of a radiographer, so a special congratulations to the CALHN mob. I thought I'd start my address to you tonight by telling you a little bit about me. As you heard, I am a proud Narungagana woman and have spent much of my life and career advocating for health systems that serves, respects and values First Nations peoples. Tonight I thought I'd take you back to where my journey in healthcare really began, some 30 years ago. That probably tells you a little bit about my age. I was raised by my grandma in a little place called Point Pearce Mission. She had a chronic health condition, a chronic mental health condition, and therefore I had many interactions with the healthcare system, both amazing and devastating, but equally as impactful. Like many of you here, I entered the healthcare system driven by a deep desire to make a positive change and a lasting difference. But like my nana, a First Nations woman, my journey also marked by profound challenges rooted in the very systems that was meant to care for us. I was the only First Nations student in my nursing degree way back when. I was in the first cohort that went through University of South Australia. It probably comes as no surprise that I faced racism, not only from the clients, but from my colleagues and my educators. And I had amazing allies, people who knew their power and their position, and that opened doors for me. And to them, I'm forever grateful. I learnt firsthand, unfortunately, at the university, the deficit discourse about First Nations people's poor health outcomes, and I saw that the problem was placed with us, not on the healthcare system. One of the most vivid stories I can remember from my days as a nurse, and there are many, was the story of an Aboriginal mum who was staying on our ward with her child. Yeah. I had handover and I was told she didn't speak English, that they were getting an interpretive service in for her because she was about to be discharged. She'd been at the hospital for 2 nights, and when I went into her room and said, "Hello," she quickly replied back in perfect English, "Hello." I went on to ask her all the questions for her discharge, and we laughed as she told me all the conversations that had happened right in front of her by the nursing staff. And you know, those days when you looked around hospitals, there was no Aboriginal Torres Strait Islander people in the curriculum that I learnt. There was no great stories about amazing nurses like Loitcher O'Donoghue. There were no Aboriginal people on our boards, and there were very few Aboriginal people that were actually, you know, your hospital clinical trained staff. So I can say, and I want to acknowledge, that a lot has changed. But this wasn't just a personal experience, what I'd experienced with this young mum. It was reflective of the broader systemic issues that has long plagued our healthcare system. One of the most pivotal moments in my career was when I encountered the work of Dr. Irahapati Ramsden, a Maori nurse who introduced the concept of cultural safety. I learned that cultural safety training is not learning about First Nations people, where the gaze is outwards, and it can be quite nice and easy learning about us. And sometimes it's almost like there's a tick box in the way that you treat Aboriginal Torres Strait Islander people. But if you've ever seen Tyndale's map of all of the various nations of First Nations people, we are beautifully diverse, and there is no tick box. I learnt that cultural safety, you know, when you're deeply in the training, it's about turning the gaze on ourselves and critically reflecting. As most of you as health professionals would know what critical self-reflection is. Learning about yourselves, learning about the systems, seeing things in the system and things that aren't in the system. Things like no Aboriginal people on boards back in my day. And learning about racism in all its forms. Learning about historical truth-telling and how the downstream impacts of that not only affect me and my people, but it also affects the broader Australian society. It unpacks equity and how a new normal was brought to this country when colonisation started. Here in Gadigal country, you have 6 seasons, not 4. That was brought here to this country. So that's what I mean when I briefly talk about how a new normal was established. Irahapati's work gave me the language and the framework to understand some of the interactions I had. It certainly gave me the framework to unpack and understand the emotions, and that I could actually name it as racism, and the deep-seated issues that I saw within the healthcare system and why they existed, and more importantly, how to begin to address them. As I advanced in my career, I became deeply involved in shaping the education and professional standards and the health service accreditation standards that would, I hoped, potentially protect future generations from the challenges that I faced. We always knew that there were good people in the system, but good people come and go. We knew that we had to hardwire it. As the CEO, as you heard, of the Congress of Aboriginal Torres Strait Islander Nurses and Midwives, I worked fearlessly with nursing and midwifery leaders, and they were fearless leaders if you ever saw the newspaper articles back then, to embed cultural safety into nursing codes of conduct and into the National Registration of Health Professionals legislation, which took 12 years to get in place from the moment we first started advocating for it. This was a crucial step in ensuring that all health professionals in Australia understand their role in providing culturally safe care that is grounded in equity and justice. We know that racism in healthcare isn't just about poor bedside manners. It has lethal consequences, and it comes from the stories we are told. The stories of young Aboriginal women that resonate with me, whose lives were cut too short, are that of Miss Dew and Miss Williams, whose coroner's cases I had the privilege of being on, who died preventable deaths because of racial bias within the healthcare system. This is stark reminders for me of the work that we have to do. But we can have all the standards in the world, but what really matters and what we need in addition are meaningful clinical measurements. Yes, it's important that First Nations people feel welcome in healthcare services, that they get to fill out a survey, but what's more important is that they experience the same health outcomes as all Australians. One of the most troubling aspects of racial bias in healthcare is how it manifests in clinical indicators and decision making. For example, studies have shown that First Nations patients are less likely to receive pain relief compared to non-Indigenous patients, presenting with exactly the same symptoms. I've actually been with a healthcare provider and said, why didn't you give more pain relief? And that person told me that First Nations people don't feel pain the same way. This bias extends to the misdiagnosis or the underdiagnosis of serious conditions, leading to delayed or inappropriate care. And when we look for clinical indicators of bias, we must examine, of course, the broader systemic issues that lead to the inequities in healthcare access and outcomes. The NHS in the UK has undertaken significant work in this area, identifying key indicators such as rates of minority populations accessing organ donations and transplants, and participating in clinical trials. These indicators are important because they reveal underlying disparities in how different populations are treated within their healthcare system. In Australia, I propose we need to adopt similar approaches to identify and address racial biases. For instance, we should be looking closely at the rates at which First Nations peoples are referred for and receive organ transplants compared to non-Indigenous Australians. Similarly, participation in clinical trials is another critical indicator. Clinical trials are essential, as you would know, for advancing medical knowledge and treatment options, and they are a gateway to cutting-edge treatments. Yet First Nations peoples, surprise, surprise, are often underrepresented in these trials. This not only limits the relevance of research outcomes for our communities, but it also denies us access to potentially life-saving treatments. Further, the knowledge translation from these studies is not based on evidence that includes our unique health needs. This means that the treatments and the guidelines developed from such research may not be effective or even safe for our communities. For example, studies on cardiovascular disease, some of you might know Dr. Alex Brown, which is, cardiovascular disease is a leading cause of death amongst our people, and it's historically underrepresented our populations in any of this research. As a result, the treatment protocols from these studies may not adequately address the specific risk indicators and the health profiles of our people, leading to poorer health outcomes. These are just a few examples of clinical indicators we must monitor to uncover the racial bias in our healthcare system. At the moment, I think one of the indicators that we have is discharge against medical advice, and I ask you to think about that and where it places the problem, on the system or on the person. By doing this, by changing it up, we can begin to dismantle the systemic barriers that prevent First Nations people from receiving the same quality of care as their non-Indigenous counterparts. This work exemplifies cultural safety, which is of course part of the standards and accreditation processes that govern our healthcare system. Collective First Nations efforts, of course, which I was a part of, with the Australian Commission on Safety and Quality in Healthcare, has focused on embedding these principles into the standards that healthcare providers must meet. And of course, it's work that we're proud of. Cultural safety is critical to accreditation as clinical excellence, because without cultural safety, there is no true clinical excellence. Today, as I stand before you as a member of my community that has been both a client, a receiver of the care, and a provider within the healthcare system, I know what it actually feels like to not feel trusted, unsafe, unseen, unheard because of my cultural heritage. And I'm a trained health professional. And I know the transformative power of healthcare systems that are truly equitable and demonstrate true allyship. Allyship that understands who built the system, who the system was built for, who benefited, and who was locked out. We've come so far. It's hard won, what we have got, and it's something that we have to hold on to. There's much in the Australian media at the moment that's repealing very basic and simple things, such as a welcome to country. So I urge you to hold on to what we've got. And we have travelled at the speed of trust together to gain equity. And equity, to me, means not giving everyone the same and expecting the same outcome. Equity to me means understanding people don't start from the same starting point. So we need to meet people where they're at and ask people what they need. As my friend and colleague Adam Schumacher says, you can be excellent at equity and excellent because of it. And he goes on to say that equity without excellence is a promise without a place. So I encourage you to be brave, to be fearless. It's my hope, dream and aspiration that we build a system, a healthcare system where First Nations people not only receive equitable care, but where they see themselves reflected and respected at every level of the healthcare system, where we are trusted and where we're asked what we want, what are our needs. Finally, I'd like to close with a story, and I hope that it resonates with you all. A few years ago, I had the honour of listening to one of my mentors who's now sadly passed away, Dr. Moana Jackson. Dr. Jackson was a Māori lawyer and a social justice champion. He delivered an oration on Yorta Yorta country in Shepparton, Victoria. Dr. Jackson captivated the audience, sharing stories that were both simple and profound as he explored important matters such as treaty, sovereignty and self-governance. He began by telling us about his 8-year-old granddaughter, or his mokupono, whose first language was Māori. However, she was being required to now learn English. As she sat next to her grandfather one night with a list of English words, she asked him what a particular word was. She spelt it out for him, F-U-T-U-R-E. When her grandfather replied, well, that spells future. She asked him, what's that? The future, he said, is when we take all the times of our past, bring them into your today and carry them into your tomorrow, and then all of your other tomorrows. This little girl, quite excited, hopped down off the couch, went to the garage and got her bike and started off down the driveway. Where are you going? Her grandfather called out. I'm going to look for my future, was her reply. As she headed off, a young Pakeha, or non-Indigenous boy, who was her friend from next door, chased her down the driveway. Where are you off to? He yelled. My future, she replied. Can I come? He asked. If you can keep up, she replied. And what a profound and beautiful gift Dr. Jackson brought to us from Aotearoa with that story. And it asks two big questions. Will you come on the journey with us to here and beyond? And can you keep up with us on this journey? Because our future depends on it. Thank you, everyone.
Thank you very much, Professor Mohamed. We're honoured to have you here this evening to speak about such an important topic with us tonight, to challenge us to find meaningful clinical measures, which is so important, and to focus on the same health outcomes, and highlighting to us the key issues that still need addressing. Please join me in giving Janine another round of applause. I'd like now to invite Professor Len Nataras to come to the stage to close the formal aspects of the program for this evening. Thank you, Len.
Thank you so much, and let me express as well, Janine, what a phenomenal inspiration. You are the future. And if we each and every one of the 108 or so people here tonight take that leaf from your book and your speech, it will be a wonderful future for all. It's about equity, it's about respect, it's about taking people where they should be and they deserve to be. It's been an extraordinary evening, an evening of inspiration, an evening of people who have actually done wonderful things for the healthcare sector. It's my task to say the evening's ended now. Not quite. You've still got a little while to go. The formalities have ended, and now's the time to do something that my good friend Neil Fong often says, network, network, network. Use the opportunity that you have tonight to meet others, to actually talk to others and to learn from them as well. So again, thank you, and safe travels home, wherever that may be. Thank you.
Happy 50th. Happy 50th.